LSI 2021 at the beautiful Ritz-Carlton Laguna Niguel. It's nearly true tales of innovation. I'm your host, Benjamin Glenn. My guest is Phil Rackliffe at LSI 2021. Phil, thanks for coming by the studio.
Thank you very much, Ben. Great to be here.
So Phil, what brings you out? What are you coming to the conference for?
Yeah, so I lead and I'm a CEO of a company called Centerline Biomedical. We're a spin out of the Cleveland Clinic. We spun out in about 2015, and we provide enhanced three-dimensional surgical navigation for endovascular repairs. And to say that in layman's terms, we do essentially what is Google Maps for inside of your body.
Wow.
For surgical procedures. So it's really exciting and great to be here. We create a three-dimensional algorithm based on a preoperative scan that we get from you, and then we do an intraoperative scan as well. We understand where you are on the surgical table, and there's an electromagnetic field generator that actually allows us to track catheters and guide wires in real time as you try to cannulate target vessels in order to perform your procedure. What we have done is the analogy of now Google Maps in order to get from a point A to point B in your body, in order to perform a surgery with less time a procedure, less radiation exposure because it's a non-radiation source, and less contrast dye. And we've seen some phenomenal outcomes in our controlled launch, which has begun, and we're in 7 U.S. institutions at the moment.
Can you tell us more about that, or is that still behind the curtain?
I could tell you a little bit about it, that we're at large Luminary leading facilities in the U.S. We've performed about 40 cases so far, and I'd be remiss not to tell you about one of them. So there was an 81-year-old patient, female. She went in for a mesenteric repair. So that's an artery that feeds a lot of your gut, and she had a lot of GI distress, and it was very much stenosed or cut off. The physicians under two-dimensional fluoroscopy actually spent 4 hours on this patient and hit the radiation dose levels, and were never able to get a catheter and a guide wire into that mesenteric in order to perform the repair. That's point A. Point B is 1 month they'd go home, they're frustrated, the patient doesn't get the procedure done, they still have an upset stomach and all the complications, and the staff is very, they're not feeling good about how the day felt because they didn't get a procedure done. They come back 4 weeks later with our product called the intraoperative positioning system. That's the platform technology that we're marketing right now. They go in, they cannulate that mesenteric artery in 24 seconds. And the entire OR started clapping. And it's the first time in my 25-year career I had ever seen an operating room literally stop and clap. It was a surreal watershed moment for me. And that's the value of this technology and what we can mean to patients and providers and healthcare systems.
Wow, Phil, that is such a great way to, provide, technology meets time. That's OR time.
It's OR
4
time.
hours of OR time. 4 hours. How many? 2 surgeons on this?
2 surgeons, 7 staff, and it's not even OR time. But then you think about that, the immense amount of radiation and the issues of radiation exposure. You look at surgeons; they're 12 times more likely to get left side brain cancer, vascular surgeons, because of that radiation. Cataracts are through the roof. So it's not only what we do to help the patient have that procedure better, but the staff that's involved with it as well is just as critical.
Phil, you mentioned that your company Centerline is actually partnering with these Luminary foundations and hospitals around the country, but don't you come out of one of the Luminary hospitals in the country?
Well, we do. I think it's the #1 for 20 straight years heart and vascular program and cardiovascular program in the world, which is Cleveland Clinic. Mm-hmm. And this technology was actually founded at Cleveland Clinic about 10 years ago. And the story is very near and dear to everybody at our company's heart because the physician that really thought up of this idea of 3D computation for complicated surgeries was a luminary in the space named Dr. Roy Greenberg. Dr. Greenberg worked with our chief technology officer and founder, Vikash Goyal, who came out of Cornell in computer science, and they came together to create what we know today as Centerline. And the unfortunate part of the story and why we're so mission-based is that Roy fell sick about some years ago and actually died of a rare cancer that we can't help to think was caused by radiation.
Oh, that's terrible.
Yeah, yeah, it was
But
a very, very
it's
sad
also,
story.
but it's
Yeah.
also where a lot of this
It's where the
clinical
passion
need comes from.
It's where the passion comes from. And Cleveland Clinic's been an incredible partner for us. We get access to the facilities,
Wow.
and really we've launched a number of cases there with great success. They're actually one of our first two clinical sites for our motion study. It's a motion clinical trial that's going to help support our European approval. It's between Cleveland Clinic and University of North Carolina. So two great sites for vascular surgery. But as I think about like the greater ecosystem for Ohio and what's really come out of there, um, we've been very fortunate to find incredible engineers, top talent, operational individuals, because that's where our headquarters is. We've got about 30 FTEs and full-time equivalents right now. But being able to tap the feature frankly, of Ohio, but like Columbus, Cincinnati, we worked with funding partners like JobsOhio has been incredibly helpful as far as putting money into us, helping to grow that economic development. And there's just a great talent bed in that Ohio area.
The ecosystem and the community, that's just so important for me because I think as I look around the country, we've got so many great little pockets. I think if more innovators knew that there were these places where you can grow a company, there's a talent base there. Maybe even investors need to get the word. But can you tell me more? I think, don't you benefit from some of those programs in Ohio?
Yeah, absolutely. I actually, when I took the job and moved from another city on the East Coast, I thought to myself, oh, acquiring talent's going to be challenging, or we're not going to be able to get the funding we need. It's been the complete opposite. So we've been able to tap the leading institutions in Ohio, whether that be in Cleveland, Columbus, Cincinnati. We've worked with the JobsOhio team, both from a funding standpoint and actually from an innovative way. They've created really 3 innovation hubs across Cleveland, Columbus, and Cincinnati that's really developing great talent. There's new medical device, med technology, biotech, diagnostics coming out of these cities. And the amount of talent out of these leading institutions is great. And so we've been able to have a lot of terrific hires that are local and can help fulfill our mission. When I think about, so I've lived in Boston for a number of years. I've been on the West Coast a number of years and overseas. First of all, there's a huge benefit in just cost of living, right? So we were able to attract people from both coasts to Ohio, and they find it a win-win. An innovative company making meaningful difference to physicians and patients and healthcare systems, and a cost of living that is significantly better than either of those other two coasts. I think that's really one. And then I was surprised to find out how much innovation actually resides in Ohio that doesn't get the type of accolades that you would expect. And I think those two things together make it an area where people do want to come to. You've got a great playhouse district in Cleveland, as an example, one of the leading ones across the world. You've got professional sports teams. I mean, it's all there.